This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about, do steroid injections hurt? If you like this video, we put out new content weekly, so please like and subscribe. So do steroid injections hurt? It depends. It depends on your tolerance of pain and also where the injection goes. So the steroid itself isn't really painful. It doesn't really cause like burning pains or anything, but it depends on where the needle is going and how thick the needle is. So people think the pain of a needle is how long the needle is. That's not entirely true. It's really the thickness of a needle. So when you have a thick needle, it's measured in gauges. So a thick needle would be like an 18 gauge needle. The lower the gauge, the higher the needle. The thinner needle would be like a 25 gauge needle, or even 27, or some people even use 30 gauge. So the thinner the needle, the less it should hurt. But there's some pluses and minuses to using a thin needle. If you use a thin needle sometimes and you inject it in a certain spot, the needle is not very strong and it can actually break off. I've seen that before. I've never seen it before with a 25 gauge needle, but I have seen it for 28 gauge needles. That's why the thinnest needle I use is a 25 gauge needle. But anyways, so the needle choice makes a little bit of difference. You can spray some, I'll use a numbing spray on the skin so the needle doesn't hurt too much. But really, it's where the injection is going. So if the injection is going into an area that has a lot of space, it generally doesn't hurt too much. So like if it's a knee or like the shoulder, there's a lot of space there. And especially like with the knee or the shoulder, they're generally not too deep. So those aren't usually super painful injections. The smaller the space, the tighter it is, the more it can hurt. So the most painful injections actually are in the palm of the hand for, let's say, a trigger finger, or the bottom of a foot, which some people will do for plantar fasciitis. That skin is really thick and it doesn't move a lot. You can see that if you try to pinch the skin on the front of your hand, you can't do it, while the back of your hand you can. That's because there's something there called the palmar fascia. So whenever you inject into a space like that, those are usually the most painful injections. Even though it's a small amount of fluid, it's a small needle being used. But I would say foot, bottom of the foot, hand are the most painful injections, and then probably some of the less painful injections are knee and shoulder. This assumes that the injection is being done correctly. If it's off angle or it goes in the wrong spot, it can certainly be painful no matter where it goes. But that's a general rule of thumb. So do steroid injections hurt? If it's done correctly, usually not. In some areas, like the hand to the bottom of the foot, they usually do hurt. Depends on the thickness of the needle. Thinner needles usually hurt less, but if the needle is too thin, at least it makes me feel comfortable, so I don't use them. So I hope I was able to answer your questions on if getting a steroid injection hurts. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond, but I can't give you any specific medical advice. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.